All of us know somebody who has been impacted by heart disease. And if you don't know somebody today, you might know somebody tomorrow. Your loved ones could possibly go through the same experience that mine did. We were celebrating my 50th birthday that day, and we'd been out to dinner. We had gone home and enjoyed some German chocolate cake, and one of the children wasn't interested in that. My husband went to the cupboard to reach for a package of Oreos, and he felt a pain in his shoulder. He was having some nausea, and then he said, "I feel as if there's a vice squeezing my chest." And that's a very classic symptom of a heart attack. I called my children on the phone and said, "Dad is having a heart attack. He is going to be transferred to McKay in an ambulance." And that right there produced a great deal of fear and anxiety in my children.
Because of the community's generosity, we're able to make the Cancer Treatment Center a reality in Cache Valley. We're hoping for a similar level of support for our interventional cardiology program. Just like cancer, heart disease affects a large number of people in our community. 20 to 30% of the people that we transfer out of our emergency room are transferred out for heart services that we cannot provide at this time. By building this program, we're hoping to be able to serve those patients better.
My husband is very close to his children, and when he ended up being transferred to a facility out of the county, that meant that he could not see his children on a regular basis. He couldn't comfort them personally. He couldn't hug them. He couldn't have them at the bedside to reassure himself and them that everything was going to be okay.
I put myself in the patient's shoes or in the family member's shoes, and I picture that ambulance door closing or the life flight helicopter taking off as after a patient comes to the emergency room and is diagnosed with having a heart problem and they need to be flown to another hospital. And I worry about those feelings that they have. And it's difficult sometimes for the hospital to bring a lot of new services because it takes a certain amount of disease, let's say, in order to have a quality program, to have enough of these procedures in order for a physician to be skillful at them. And we feel that we're at that position where we can now expand and include this service for the community.